Did you know that 12 to 15% of couples of reproductive age are disturbed by infertility? Ever wondered why this happens? Infertility, a term that can be heavy on those who carry it, is the inability of an individual, whether a man or a woman, to contribute to conception or for a woman to carry a pregnancy to full term. It's a condition that affects a significant number of couples worldwide, estimated at about 1 in 7 couples. But what exactly causes this? As with any biological process, conception requires several elements to align just right. For women, one of the most common causes of infertility is irregular ovulation, where the release of eggs from the ovaries becomes unpredictable or non-existent. Other factors may include conditions like polycystic ovary syndrome or primary ovarian insufficiency. Physical complications such as blocked fallopian tubes or uterine abnormalities can also play a part. For men, infertility often comes down to issues with the sperm. This could be insufficient sperm production, abnormal sperm function, or blockages that prevent the delivery of sperm. Illnesses, injuries, chronic health problems, lifestyle choices, and certain genetic disorders can all interfere with sperm production or function. However, it's important to remember that infertility isn't always a woman's problem. Both men and women contribute to infertility in roughly equal measure. And in some cases, the cause of infertility remains unexplained. It's an intricate puzzle, with each piece needing to fit just right for conception to occur. But all is not lost for those facing infertility. Thanks to scientific advancements, there are now various methods to circumvent these issues, giving couples a chance to conceive. These solutions, often grouped under the term assisted reproductive technology or ART, have been a beacon of hope for many. Now that we've laid the groundwork, let's delve into the solutions for infertility. Fertility issues can be a tough hurdle for many couples, but thanks to medical advancements, there are solutions available. Ever heard of assisted reproductive technology or ART? Assisted reproductive technology, or ART, refers to a collection of medical procedures designed to overcome infertility. These techniques, which include in vitro fertilization, IVF, zygote intrafallopian transfer, ZIFT, and Gamete intrafallopian transfer, GIFT, among others, aim to maximize the probability of a successful full-term pregnancy. However, these treatments do come with their drawbacks, including their cost and the time they require. Now, let's delve a little deeper. IVF, or in vitro fertilization, is the most commonly used form of ART. The term in vitro means in glass, and it refers to the process of fertilizing an egg with a sperm outside the body under strict laboratory conditions. This procedure results in a zygote, which is often colloquially referred to as a test tube baby. Following a period of embryo culturing, the embryo is transferred to the mother's uterus. This method is especially beneficial for women who have damaged or blocked fallopian tubes, preventing natural conception. Next on the list is zygote intrafallopian transfer, or ZIFT. This procedure is similar to IVF, but with a slight difference. After fertilization in the lab, the zygote is transferred into the mother's fallopian tube using a process called laparoscopy. This allows the embryo to implant and develop naturally within the womb. However, this method is not suitable for women with abnormal fallopian tubes. Lastly, we have Gamete intrafallopian transfer, or GIFT. Unlike IVF and ZIFT, GIFT is an in vivo fertilization procedure, meaning the fertilization process occurs within the body. Sperm and egg are transferred directly into the fallopian tube, allowing for a more natural fertilization and zygote formation. This method is only viable if there is an adequate sperm count and at least one functioning fallopian tube. The advancements, availability, and simplicity of assisted reproductive technologies have significantly expanded the possibilities and hope for couples struggling with infertility, regardless of the underlying cause. Now, let's discuss these methods in depth, starting with the most common one, in vitro fertilization. In vitro fertilization, often known as IVF, is the most frequently used method in assisted reproductive technology, ART. But what exactly is it? Well, IVF is essentially a technique where fertilization happens outside the body under controlled laboratory conditions. It's like setting up a date for the egg and sperm, but in a petri dish. The process begins with hormone therapy to stimulate the woman's ovaries to produce multiple eggs. Once the eggs are ready, they are retrieved and combined with sperm from the male partner or a donor. This meeting results in fertilization and the creation of an embryo. But the journey doesn't stop there. The embryo is then cultured in the lab for a few days to ensure it's growing properly. After that, it's transferred back into the woman's uterus where it can continue to develop naturally. It's a complex process, but one that has been fine-tuned over the years to maximize success rates. So, why is IVF the most popular method? One reason is that it can be used in a variety of situations. Whether the issue is with sperm quality, egg production, or even unexplained infertility, IVF offers a solution. It's particularly recommended for women with damaged or blocked fallopian tubes, since natural fertilization becomes challenging in these cases. But let's not forget, IVF also allows for genetic screening. This means potential genetic disorders can be identified in the embryo before it's transferred to the uterus. This ability to ensure the health of the baby early on is a significant advantage of IVF. However, it's important to note that IVF isn't a one-size-fits-all solution. The process can be physically and emotionally draining, and success is never guaranteed. But for many couples, the chance to have a child far outweighs these challenges. IVF has been a game changer for many couples, but it's not the only method. Let's move on to another technique, zygote intrafallopian transfer or ZIFT. Zygote intrafallopian transfer, also known as ZIFT, works similarly to IVF but with a twist. Interested to know more? Let's delve into it. ZIFT is a form of assisted reproductive technology that involves a combination of in vitro fertilization and surgical implantation. The process begins just like IVF, with the woman undergoing hormone treatment to stimulate the production of multiple eggs. These eggs are then retrieved and fertilized in a laboratory setting. However, here's where ZIFT diverges from IVF. Instead of allowing the fertilized eggs or embryos to develop in a lab dish for several days, the embryos are transferred to the woman's fallopian tubes within 24 hours of fertilization. This is done through a surgical procedure called laparoscopy. The hope is that the embryos will continue their journey, implanting themselves in the uterus where they will grow and develop. In essence, ZIFT combines the strengths of lab-based fertilization with the natural process of early embryo development within the woman's body. Now, you might be wondering, who is ZIFT typically recommended for? Well, ZIFT can be a good option for couples who have unexplained infertility or for those who have had unsuccessful IVF attempts. It may also be recommended for those with male factor infertility, as the process allows for the selection of the healthiest sperm for fertilization. However, it's important to know that ZIFT is not suitable for everyone. Women with damaged or blocked fallopian tubes, for instance, would not be good candidates for this procedure. In such cases, IVF or other forms of assisted reproductive technology might be more appropriate. ZIFT, although less commonly used than IVF, has its unique advantages. It allows for a more natural environment for the early stages of embryo development, which some researchers believe may increase the chances of a successful pregnancy. But remember, every couple's journey to parenthood is unique, and what works for one couple may not work for another. It's always best to discuss all your options with a fertility specialist to determine the best course of action for your specific circumstances. ZIFT is an effective method, but it's not suitable for everyone. This brings us to our final technique, Gamete intrafallopian transfer or GIFT. Gamete intrafallopian transfer or GIFT is another method under assisted reproductive technology. Unlike in vitro fertilization and zygote intrafallopian transfer, this technique has a more natural approach. Let's find out how. GIFT is an in vivo fertilization procedure, meaning it occurs inside the body. Unlike the other methods where fertilization happens in the lab, GIFT allows the sperm and egg, or the gametes, to meet within the woman's fallopian tube. This is where the magic happens, where life starts to form. The fertilization and zygote formation is more natural as it takes place within the female body. So how does it work? The process begins with the retrieval of the woman's eggs. The collected eggs and the man's sperm are then placed together in a small catheter. This catheter is then inserted into the woman's fallopian tube through a small incision in her abdomen. The gametes are then released, and hopefully fertilization will occur naturally. Now, you might be wondering, who can benefit from this method? GIFT is typically recommended for couples who have unexplained fertility problems or issues with the cervix or cervical mucus. It's also a good option for those who prefer a less lab-oriented approach and want to keep the process as natural as possible. But remember, for this method to be successful, there must be a good sperm count and at least one functioning fallopian tube. However, it's worth noting that GIFT is less commonly used than IVF. This is partly because it requires a laparoscopic surgery, which can be more invasive and expensive. Additionally, with GIFT, there's no way to know for certain if fertilization has occurred until pregnancy is confirmed. From in vitro fertilization to GIFT, these advancements in medical science have given hope to many couples. Infertility may be a challenge, but with these methods, it's not insurmountable. The journey to parenthood might be tough, but remember, every journey begins with a single step.